it's really under that it's in third reading. Beyond that, a lot of people need technical assistance. A lot of what we do is working with families and individuals on housing applications. They need help with knowing where and how to apply for subsidized housing and vouchers. It's not uncommon to see parents list their own names and social security numbers and assets on an application and have to go back and redo that. They don't know how to keep their applications up to date. It's not uncommon for people to move without updating applications. I worked with somebody last week who had applied for Section 8 back in 2014. And when we logged on to reclaim their application, it had the wrong email address and the wrong mailing address on it. Sometimes a teacher helped a young adult with an application before they aged out of school, but the parents have no record of what was applied for and the young adult doesn't know. All I'm told is a teacher helped them apply for housing. And that's literally all they know. They don't know how to fill out the paperwork when they reach the top of a waiting list, and they don't know how to handle annual recertifications once they are in housing. It's also not uncommon for me to run into twice in the last 8 days. I've had appointments set up to help individuals to do housing applications, and they decompensated 5 minutes before the appointment and had to cancel just because they were daunted by the thought of an appointment to do housing applications. So this is not uncommon. I've also dealt with people who they can't fill out an application because they have lost necessary documents. And before we do anything else, we've got to replace the Social Security card. We've got to get a new ID card, etc. You don't need those up front for some applications, but for some you do. And then finally, staffing shortages are a problem. Somebody may have housing, but they're unable to utilize their support hours due to staffing shortages. Wages for DDS for adult companion services are not competitive. You get paid more starting at Dunkin' Donuts than you do working as an adult companion through DDS. It's hard to find somebody willing to work for a couple of hours a day. So it's not uncommon to see somebody who has 10 hours a week of support hours, but they're only able to fill 3 of them. And then Mass Health has, fortunately, finally, there is an approved code for remote supports through a tablet system now, and DDS is starting to roll it out. But most DDS service coordinators aren't even aware of this yet. And so that's kind of where I'd like to leave it right now and open it up for questions.
All right, thank you so much, Cathy. Does anyone have any questions? I do, but I'm going to hold off and let you guys go first. All right.
Hi, this is John from Triangle. I would just love to know if you've seen models maybe outside of Massachusetts that would be ideal, specifically with the neurodiverse young adults in need of the housing, but aren't meeting the thresholds of support that you laid out very well. This has been really helpful for me. Thank you.
There are some interesting models out there. One I find very intriguing is out of Indiana, and it's called CAS Housing. And essentially what they've done is they put something together where, and mind you, it's in Indiana, so land and housing is a lot cheaper, right? But what they are doing is they are putting together cohorts of 3 individuals who already know each other. And they are constructing homes that are 3 kind of semi-independent suites where individuals have their own bathroom, bedroom, sitting area, and like a microwave and a mini fridge and a sink. With a shared dining room, living room, and full kitchen, and then an accessory unit for someone they are calling a steward. And the steward is there largely for emergencies. Supportive services within the house each individual funds through their own support hours. So you might have one resident who's got 10 hours a week of support hours, and somebody else has 2, and somebody else has 15. And the stewards kind of there for emergencies, but they are not, so they've separated the supports from the housing in that sense. And I think that model probably has some real potential, but I haven't seen anybody use it yet here. The closest I've seen is the Northeast Arc has done something called Linden Street. And what they did is they took one of their old group homes and they gutted it. And they turned it into 2 2-bedroom apartments with a 1-bedroom apartment on the 3rd floor for somebody in that kind of steward role. And then they've got 2 individuals in each apartment, and there's sort of a baseline cost. And then beyond that, if you need additional services, it's a la carte, pay as you go kind of thing. So that's the closest I've seen to that.
Thanks, Catherine. We have a question from Dan about how would you recommend supporting the housing bill that you mentioned?
Right. So the ARC of Massachusetts is going to be doing an alert very shortly on this. The other thing is there's a sign-on letter for organizations. So Maura Sullivan is kind of the gatekeeper on the sign-on letter, but you could also email me if your organization is willing to sign on. And my email, I'm just going to type into the chat.
Thanks.
And if you just send to me the name of your organization, and that your organization is willing to sign on, I can forward that tomorrow.
Great. Thank you so much.
Can I ask one last question? Dan, do you want to go first?
I was just going to follow up. If we were to sign on, does that just mean as an organization, we are kind of lending our name in support of the bill?
Right. So that letter would be going to the chair of the committee on 3rd reading. And then it would undoubtedly subsequently, assuming we get out of 3rd reading, it would go to the speaker and leadership.
Okay, great. Liz, you want to go ahead?
I wanted to just ask, in terms of your observations, as people age in community, we are seeing that folks who have housing, it becomes very challenging as they age, as they have additional either medical needs or they have cognitive challenges, things that didn't exist when they were first in what was primarily independent. And as we see that shortage in staffing, it becomes even further complicated because some places are now reduced to even 1 hour a day, so that there's a lack of support. And with the lack of people going to jobs, and in the pandemic, we saw not going to day programs. So I'm just wondering, in your experience, has there conversation about a different model of housing as people age, where they could get greater support and they could move more seamlessly? Because we find that families are really devastated when they encounter these aging in place problems for their loved ones.
Right.
Mhm.
Aside from the CAS model that I described earlier, there's something that I have been talking a lot about lately that I call fraternity group rush, which can best be described as get together a group of people and apply to the same building, whether it's tax credit housing or a condo development. So it's not a purpose-built disability community, but if there's 9 people in the same building who all need a certain number of supportive services, it may be easier to find someone who can go to that building and, hop from apartment to apartment, rather than how do I get somebody to come to my apartment for an hour? And then similarly, there was the model I already talked about. The other thing I would say is I really think people need to, technology is not going to solve everything, but I think there's more technology out there than people are aware of. You can get like an iGuard stove shut off that shuts the stove off if nobody's in the kitchen for X amount of minutes, and you can set the amount of time on that. You can get something that will shut the water off in the bathroom if water is hitting the floor, so that, you know, it's preventing damage if there's a leak or something and somebody doesn't know how to handle that. So there are things like that that I think people haven't tapped into enough. And I think that, in combination with some of these tablet services that are out there, might help. Northeast Arc had a technology fair earlier this week. One of the things they were looking at was a tablet system that, you know, combined with some other things. So, you know, you could be sitting there and, you know, reading a book, and you had checked in with your person on the tablet earlier that day, and you happened to mention you fell. Well, now the doctor calls your tablet and says, hey, I heard you fell. And so they, you know, they start to combine all of this stuff. The other thing I have been toying with around workforce is, I think a lot of people, I think as a society, we're not reckoning with long COVID yet, and what's going to happen when we have people who can't work full time anymore. But they, you know, they need some kind of employment. If we look at that combined with the technology, can we start to retrain people to say, okay, I get you can't leave your house and you can't work for more than a couple of hours a day, but could you be remote support on a tablet for somebody else during those hours?
Oh, that's cool. That's cool. Cathy, I have a question. You were mentioning before how you get these applications where a teacher had helped someone apply, but then nobody else knew what was going on. So I guess, like, what would you recommend for people who, you know, whether it's a teacher or a family member or another counselor, if they're helping someone with an application, like, what would you suggest they do to make sure that everything?
Funny you should mention that. That question was actually not a setup, but I'm going to type a URL into the chat, and it's www.18section8.org. It's one of two websites my organization runs. The other one is Autism Housing Pathways. But 18section8.org is just about applications and how to do them. And in the document library, there is a spreadsheet. And so what I do when I am working with a family is that I fill out the spreadsheet as we go. It's got the title of, you know, what exactly did you apply for? You know, was it the alternative housing voucher program? Was it state elderly disabled housing in Newton? What exactly was it? What date was it? What was the website? You know, and what's the date for every time you have updated it? Okay. And so sometimes I'll work with somebody, and so I worked with somebody last week where on the Zoom, there was me, there was the parent of the young man in question. There was the social worker from Mass General, and there was the social worker from the Accountable Care Organization. And when we were done with the appointment, I sent the spreadsheet via secure email to all the participants. And the social worker at Mass General, with the parent's permission, was going to upload the spreadsheet into the medical record for the young man.
That's great.
That's the kind of thing that's needed.
That's excellent. Thank you so much.
Cathy, I have another question on the applications, since we're talking about that. This is something that we've been thinking about at DLC and we've been thinking about it from the perspective of what kinds of reasonable accommodations can the applicant make in the application process itself, whether it be in terms of alternative forms of communication between the housing authority and the applicant or whatever. I'm curious along those lines if there are specific things that you've seen that you think housing authorities on their end could be doing differently or better to make this process go more smoothly for the individuals you work with.
What I would say is that, housing authorities are like special ed directors or DDS area offices. They're all different, and how they approach things depends on where you are. Some of them are very accommodating, some of them not so much. But in general, the folks we are working with are not, by a long shot, the majority of who they work with. Our folks are a very small percentage of who they work with, and they generally don't know how to work with them. And so one of the standard accommodations that I always put in the application is meetings with the housing authority and or the landlord need to be one-to-one with an advocate present. So for example, a large housing authority is going to say, everybody who got a Section 8 voucher this month needs to come to this large group meeting where we explain the rules of Section 8. And I know out of the box, my person can't do that. Not only can they not absorb the information, they can't even tolerate being in the meeting. So that's why we start with one-to-one with an advocate present. And I use advocate because it could mean the parent, it could mean a guardian, it could mean a friend, it could be a social worker, it could be anybody. And there's usually in a lot of applications, there's an attachment where they can designate somebody to be contacted for a lot of things. Also, there's a lot of accommodations people can request that they don't realize they can request. What the law says is that provided it doesn't fundamentally change the nature of the Section 8 program, for example, you can request any accommodation, which is a change to a policy or a procedure, or a modification, which is a change to the physical unit that is necessary for the person to successfully participate in the Section 8 program.
Thanks so much, Cathy. I hope you're done. I don't mean to cut
I'm
you
done.
off.
I'm done.
Okay, all right, good. Thank you. So that was great, and we'll have you at the end for the discussion, right? So we can continue with more questions. But for now, I want to welcome Megan Sandil to the podium and hear from your perspective from BU and Boston Medical Center.
Well, thanks so much for having me. It was great to be able to listen in to Cathy's amazing presentation. And I think in a lot of ways, I'm going to start, we were kind of, what were 3 things people wanted to know? And so I'm going to kind of first give a sense of how I tend to start to think about how housing impacts health. And I think of it, for a lot of families, they're juggling what I would say are the 4 dimensions, right? Or the 4 walls of which how housing impacts health. And I tend to talk about housing quality. I talk about stability, the ability to kind of stay in a certain development, or if unfortunately they're doubled up or unstably housed, including being homeless. Then there's affordability, being able to afford the house without having to make other sacrifices, whether it be medication, food, services, healthcare, energy, things like that. And then the 4th one is location, being able to stay in a certain community, especially a community of opportunity where there may be certain transportation, certain services, or other things. So kind of quality, stability, affordability, location. And in my experience as a pediatrician and others is that those kind of 4 dimensions, there often are trade-offs that families are making, right? Oh, I'm going to live in a certain community, but it's going to be super unaffordable to me because I want to be able to access a certain school system, or I want to be able to access a certain set of services. Or I am going to only be able to afford a certain unit, and I'm going to accept a unit of lower quality. And so I think it's really important when we're talking to families, I think, being able, and individuals, being able to understand what matters most to them and how are they balancing those four? Because I do think that in a lot of times, unfortunately, I've sometimes had situations where I'm trying to solve one problem, and in solving one problem, I give them two more new problems that they need to be juggling and thinking about. And so I just want to kind of lay that out. And I think, you know, I started being really interested in housing like 20 plus years ago around asthma and housing that was substandard and making people sick and things like infestations and other things. And I think we're really lucky. We live in Massachusetts where many of those things are illegal, right? You know, I like to say anything that you think should be illegal under a quality problem generally is illegal. We do have issues related to the enforcement, though, of that housing code, because it is done on an individual town level. So you have 365 towns, you have 365 public health departments that are enforcing that code. And so being able to understand in your locations, who are the public health inspectors, who are the code enforcement, what are their rules, how do you start to think about it? And being able to do that, I think, becomes really important. And also really recognizing that quality takes on different forms. There's the things that make you sick, and then there are things that kind of promote health, right? Having a space to learn, having access to green space and other things. And so I always like to say that physical quality is important both for physical health, but it's also important for mental health and development. And so being able to think about it and being able to enforce it. I think as we think about stability, we are a right to shelter state. And what that means is that if you become homeless and you document that you don't have a place to live and you are of a certain income, and I've had, unfortunately, families not approved for shelter because they make $2 more than what is the limit. But these are ways in which you can be able to find shelter so that individuals don't have to sleep in a place unfit for human habitation. But what's often difficult is you don't get to choose where that shelter is. And so oftentimes families can be placed in certain types of environments, hotels sometimes, or shelter environments that are very far. And so being able to write a really good, reasonable accommodation letter and being able to advocate that maybe this person's disabling condition is making it so that they need to either stay in a certain community and or be in a scattered site apartment that sometimes are being facilitated, I think becomes really important. And so understanding those shelter rules and how to work with DHCD and how to work with the placements early in the process, I think becomes really important. Affordability, and I think Cathy gave a great kind of how do you start to navigate the system, and I'm definitely going to check out the 18 Section 8 website. But I also wanted to put in the chat, there is a new program called Housing Navigator. Oh, sorry, I gave it just to Julie. Housing Navigator mass.org. And what this is a centralized repository of all of the different buildings who have waiting lists that are open that you can apply for. And we're not quite to a universal application system. Stay tuned. They're trying to move towards it in terms of not having to apply to every single building. But right now, it really is kind of almost like squeaky wheel gets the grease. If you put out 50 applications, you increase your likelihood that you're going to get it. So getting good at this, you know, these paperworks and what are the letters and getting to know the officers and things like that. It really is a navigator system that requires expertise, but it is a system that sometimes you're able to get to a better outcome with this type of intentionality. And so this is a relatively new website, but it gives you a sense of, especially if there's a certain location, what are the available options that are available there. And so I really encourage, oftentimes people are eligible for affordable housing options. There aren't enough of them, and we definitely need to pass bills that have additional supports around it. But I think that becomes really critical. I'm going to do kind of one last piece around kind of concepts of reasonable accommodation, and then open it up for questions. I will admit that I know that as a physician, I've never been trained to write a really good letter. And so I am very hesitant with lawyers on the call. They're very good and they're much better at writing letters than I am. But I'm just going to share quickly, and I can send this to Julie to be able to disseminate to the group. But I've been, oh, I can't share my screen. Hold on a second. Let me just walk through the concepts and then I can, oh, I'm a co-host now. Thank you. Is kind of ideas around being able to think about specificity. And so in this case, I think it's important to be really, really super specific around kind of your writing for this reasonable accommodation and what rule you're trying to get accommodated, right? So it's really critical to be specific. What rule are you trying to do? Because what happens sometimes is, I know I've had patients come and say, I need an extra bedroom. My child is being really stimulated too much. They need the separate bedroom. How do we do it? And so some people write, I'm requesting that so-and-so get a separate bedroom. That's not enough information for the housing authority to easily make that decision. And so I often say it's really important to assert what rule you're trying to get. So you're trying to ask for the separate bedroom based on household size, right? So normally household size would ask for this many bedrooms. Now you're asking for a second. And then really talk about the disabling condition. And the good news with housing, obviously, is you don't have to be Social Security disabled. You're just talking about an activity of daily living that is being interfered with. I think it's important to always talk about your relationship to the patient. How do you know this information? And so what's your history? And then I think it's really important to talk about what are the consequences if this is not accommodated. So especially when you're thinking about if this is not accommodated, they will not be able to, they are going to have issues with school. They are already starting to have issues related to, like, I think it's important them to see this, what good things are going to happen if it's accommodated, what bad things are going to happen if it's not. And then I think it's really important to say those magic words. You are seeking a reasonable accommodation. And especially if it's severe, it is a medical emergency. You consider this to be really critically important because all of those are kind of key pieces of information moving forward. I think it doesn't necessarily mean that you always get it the first time. And oftentimes they may want it on their special paperwork, or they might want certain, other documentation. But I find those kind of key pieces of information really critical to being effective in getting the accommodation. Because just like I said, if it's illegal from a quality perspective, generally things can be accommodated with the right documentation. So I'm going to pause after a lot of information and open it up for questions.
Thank you so much, Megan. That was great. And I was about to ask the question that you just answered about what does make a really good accommodations letter. So thank you.
Yeah, I'll be happy to send you via email. This is just a templated letter that I share internally at Boston Medical Center. So just like take it off the BMC logo and feel free to use it. And especially when you're working with, frankly, like doctors that don't know the process, sometimes a templated letter really helps them write a much more effective advocacy document.
That's great. Thank you. Yeah, if you send that to us, we can send it around to everybody. Thanks. All right, well, people might be thinking of questions, but I just want to sort of note that in the chat, yeah, Cathy and Jacob were talking about, how a health issue isn't considered a legally adequate reason to break a lease, but Jacob said that they've had some success requesting reasonable accommodations who want to break their lease early. So just wanted to put that in the mix here if there's more talk about that, or if anyone has other questions for Megan. Bev?
Yeah, quick question. Thanks so much. This is super helpful. At what point in the process is this letter submitted?
Yeah, typically when a family, so for instance, sometimes I have families that need the extra bedroom, or sometimes they are having really severe issues and they've tried all the other remedies, right? Like they are, you know, requesting the house to be fixed or other things, and things are really not working. So they may seek a transfer, or they want to go to a different unit that requires different things, especially if there are mobility issues. If they have like a child that now may be wheelchair bound or something like that. Or sometimes if there are other sensory issues, right? And so typically it is either because you're seeking a change to the housing that you would create this reasonable accommodation letter, or at the beginning of the application process, you say, this is the type of unit that I need. And as you sometimes will look around to different, I always joke a little bit, the Boston Globe advertises a lot of affordable housing. If any of you read the physical paper, like I do still, there are these, you know, Maloney Properties will be advertising. And oftentimes there are some dedicated units only for people with sensorineural issues. And so the only people that are eligible for those units are ones that document those types of things. And so being able to understand it, a reasonable accommodation, either at the early stage application, or if the current housing situation is making someone sick, what are the ways in which you can use a letter? They actually just recently, I'll dig up the reference and put it in the chat. The Journal of American Medical Association, JAMA, published where doctors wrote letters to landlords to make housing code changes and actually showed them to be more effective, or to be effective in getting landlords to make accommodation changes to units, whether it be carpet or infestations or other types of things.
Thank you.
That's great. Megan, do you know, I worked with a lot of families whose kids are transitioning and want to actually renovate their house to make it appropriate, you know, for a growing child. And like you said, that, you know, sometimes now they're in a wheelchair. So do you know, I mean, and I know there used to be some loan programs that would help families do those expensive renovations. Do you know what's happening with that now?
Yeah, that is a great question. There definitely are, well, I think there's two sides. I will say, if you are working with families on Medicaid, there are programs through the Medicaid Accountable Care Organization, or ACO programs, and they have some services called flex services or flexible services. And one of the approved uses is to do physical renovations and accommodations to housing. So I think it's a really important program to note, and particularly some in Western Mass. The Be Healthy ACO has been working with some of the community development corporations to do those types of programs. I think first and foremost, you want to make sure that you're getting a good occupational therapy assessment for what is needed. And so there often are programs, and this is where you may want to tap into, like, their Medicare funded programs through either Blue Cross Blue Shield or United Healthcare or other things, where you can request that assessment, so you know what you're doing is actually meeting the accommodation needs of the person. And then as far as financing, I think there are two mechanisms. One is there's Rebuilding Together, which is actually almost like a volunteer service, where you work with this organization where they will get donations, and sometimes people can get the costs offset that way. You need a wheelchair ramp, or you need other types of things. And so that's one. And then sometimes there are also local, like in the city of Boston, the Department of Neighborhood Development, now is called the Mayor's Office of Housing, has had certain types of home renovation type of funding that can be available. So it really is a little bit about like private funding, public funding, insurance. Those are like the three sources that I would seek out to see whether or not there are ways to look at it.
There's also the home modification loan program through Mass Rehab and CDAC. And CDAC has, it's a major link on the front page of their site. You apply through one of the Housing Consumer Education Centers, which is like Metro Housing Boston, SMOC, HAP, all of those. And you can borrow up to $50,000. And depending on income, it's either 0% interest with all payment deferred until the title to the property changes. Or if you don't fit that criteria, it's 3% interest, and they have some grant capability for landlords as well.
Thank you. Wait, can you say the name of that program again? The homeowners?
The Home Modification Loan Program.
Great, thank you. Thank you.
It's probably worth mentioning as well, and this kind of fits in a little bit, that at least under Massachusetts law, there are some forms of reasonable modifications that the landowner, that the homeowner is required to provide if they are in the buildings that are, I think it's over 10 units. So if it's sufficiently large and it doesn't impose a severe financial burden on the landlord, there are certain modifications that they have to provide as a reasonable modification under Massachusetts law and pay for.
Okay, thanks. Yeah, that's helpful too. Yeah. Oh, thanks, Megan, for putting these links in the chat. Yeah, this stuff is really practical and useful.
Yeah, I love CDAC. CDAC is it's a amazing organization, and one that just the nicest people, and have a lot of different supportive housing funding and other things available too. Yeah. It's a great resource.
Great. All right. Thank you so much. Okay. Well, Megan, it seems like you will be able to stay for the end. Great. So thank you for adjusting your schedule. And so we'll have Megan at the discussion at the end in case anything else comes up. But for now, we will go on to Andy from the Boston Center for Independent Living. So Andy, let's hear from you.
Hi, good morning, everyone. My name is Andy Foreman. I work at the Boston Center for Independent Living. We are the largest independent living center in the state. One of the things that we do is we assist people in conducting housing searches. But we also have a personal care attendant program, a youth program, a community organizing department. So we do lots of other things besides help assisting people with housing. We offer a twice monthly housing search workshop that I co-host with colleagues of mine, first and third Wednesdays of the month. And that's generally for folks actually looking for housing, and we go through it's a workshop. We don't complete applications at the workshop. We just give them resources and tell them or advise them what they need to do. The biggest barrier towards a housing search is supply and demand. The demand for affordable, subsidized, low rent housing is way more than the supply. We talk about the waiting list, and everyone wants to live in Boston. It's people do, obviously, but it's the waiting list for people without priorities, and I can talk about priorities in a second, but without priorities is quite long. We usually tell people that the two most important things in conducting a housing search is, number one, completing as many housing applications as possible, and number two, being as geographically broad as possible. Like I said before, the closer to Boston you are, the longer the waiting list is. In fact, folks without a priority who apply to the Boston Housing Authority for public housing is a 10 to 13 year wait because of the demand for people to live in Boston, but also the fact that people with priorities are jumping ahead of them on the waiting list. Priorities are homelessness, and homelessness is defined as either A, living in a shelter, B, living on the streets, or C, getting a reasonable accommodation letter, or a letter from your medical professional saying that, for example, Andy can't live in a shelter or on the streets due to his legal blindness or due to his disability or whatever it is. Couch surfing, moving from my couch to your couch to whatever, is not homelessness. So that is kind of the number one priority, followed closely by a victim of domestic violence. So these priorities, a no-fault eviction is a priority. Paying more than 50% of your income towards rent is a priority. A victim of a hate crime is a priority. A disability is a tiny priority. You have to be able to prove these priorities, and priorities move you up the waiting list. So in terms of what I said, if you didn't have any of these priorities, that's just say you were living at home or you were couch surfing or something like that, the wait in Boston for public housing might be 10 to 13 years long. In the Plymouth Housing Authority, that same wait would be a year. It's still a year, but it's not 13. In Haverhill, up north, it's a year, it's not 13, so it's far and wide as you can get. I think my all-time record of assisting someone with housing search was in like 3 months, but that was way out in Irving, Massachusetts. So obviously the demand to live in Irving is much less than the demand to live in Cambridge or Quincy. There's two types of Section 8. And everybody, of course, has heard of the Section 8 programs. There are consumer-based or tenant-based vouchers, and there are also project-based vouchers. So the consumer-based or tenant-based voucher is think of it as a coupon. And instead of saying 30 cents off Cheerios or something, it says basically 70% off your housing. The tenant-based, consumer-based voucher has the person's name on it. So it would have Andy Foreman's name on it. Basically say Andy Foreman is eligible to receive 70% off your housing. And you use the tenant-based, consumer-based voucher just like you use a coupon in the store. You don't go into the store and tell the customer service that you have a coupon. No, you go to your cereal section and pick up your box of Cheerios, and when you're ready to pay for it, then you hand the cashier your coupon. Works the same way with housing. Although discrimination and prejudicial treatment is illegal, it does happen. And the way to avoid that is not to say that you have the voucher until you're actually ready to use it. So if I had a voucher and I was calling a potential landlord, I wouldn't tell them, I wouldn't say, hey, do you rent to Section 8 folks? Or do you accept Section 8 certificates? Because that kind of identifies me, and they could act prejudicial or discriminatory and say, no, we don't have housing, or we don't rent to folks in that situation, which is illegal. And there's options, fair housing complaints. You can go to the Mass Commission Against Discrimination. But to avoid all that, you don't identify yourself as having a Section 8 voucher until you're ready to rent the place. And if you went into the place and I didn't like the apartment, too big, too small, whatever, I walked out, shake the hand, whatever, and never let them know that I have a voucher. It's just a way to avoid kind of the nastiness. There are two kinds. So the consumer-based voucher is basically the way there's no special list or special application. You can go on anywhere on Craigslist or Boston.com. Housingworks.net is a great resource, used to be Go Section 8. You have the ability to make a market rent apartment lower subsidized within all Section 8 of income ceilings. So in Boston, they're worth approximately $22,000 for a 1-bedroom voucher. The bedroom size of the voucher goes up. It's different prices in different counties of Massachusetts. It's based on area median income, which changes. Plymouth County is a little bit lower than Suffolk County, et cetera. But so you have the ability to go in and in Boston and rent a $3,000 condo in the Back Bay, because that's over the income limit. So that's a problem. There's a couple problems using vouchers. One of the problems are the discriminatory prejudicial treatment. The other problem is finding something that is affordable. The tenant-based, consumer-based voucher is a great program, the longest waiting list, and it's very hard to get those type of vouchers. There are two types of consumer-based vouchers. There is a mobile voucher. I guess they're both mobile, but the first mobile voucher is mobile in the country. So if you get the voucher administered by the Brookline Housing Authority, administered means the Brookline Housing Authority pays at 70% of what you don't pay. You could transfer that mobile voucher to Austin, Texas, or Hawaii, or anywhere in the country, and you go the same way and look for housing, and you have the ability to subsidize it. There's also state voucher. So there's a mobile within the country you can use anywhere in the country. You can transfer it and use it anywhere in the country. The other two vouchers are state vouchers, the MRVP, which is the Massachusetts Rental Voucher Program, and AHVP, the Alternative Housing Voucher Program. Those are state vouchers, works the same way, coupon, but you can't rent an apartment in Connecticut without voucher. It's only good within the state. So for example, I helped someone get a alternative housing voucher program from the Sandwich Housing Authority, and he is using it to rent an apartment at Avalon in Acton. So it's good anywhere around the state. The other types of vouchers are public, they're called project-based PBV, project-based vouchers. So there are two vouchers. The first is consumer voucher. The project-based voucher is where the project is the one that is subsidized. The person living in that project takes advantage of the 30% rent of their income. So they take advantage of the project, of the subsidy. That is not yours, so you don't take the voucher with you when you leave the apartment, if you leave the apartment. But whoever lives in that apartment, the housing authority or management company, whoever manages that, takes your income, multiplies it by 30%, and that's your rental share. So if I live there, my income is $2,000 from Social Security disability insurance. I'm paying $600, 30%. I move out, somebody else moves in with, $800 from supplemental security income. They're paying $240. So for the same exact apartment, same location, same square footage, because the rent is based on in general, whatever voucher you're talking about, your rent is based on your income. But in project-based, the voucher is connected to the unit. It's part of the wall, it's stapled to the rug, whatever. So those are the kind of the vouchers that people get. There's also So there's public housing, which is housing run by the housing authorities. There are 240 different housing authorities in the state. Most towns in the east part of the state have their own housing authority: Boston, Arlington, Cambridge, Braintree, Weymouth, Plymouth, whatever. But towns out west, where the towns are smaller, there's one housing authority representing 5 towns. And the housing authority does lots of different things. One of the things they do is they manage or own properties in that town. So Braintree and Braintree, Quincy and Quincy, Chelsea and Chelsea. So to apply and all these housing authorities run these project-based voucher units where the voucher is connected to the unit and people apply to these housing authorities. There's a website called CHAMP. So it's gotten a lot easier in the last, 10 years to apply for public housing. It used to be that people would have to call all 240 different housing authorities and fill out 240, if they wanted to apply everywhere, complete to all 240 housing applications. It's now gotten a lot easier. There's a website called CHAMP, which is the Common Housing Application for Massachusetts Public Housing. You go into the website, you create an account, you complete the application one time, and there are drop-down menus where you can select the housing authorities that you want to have your application sent to electronically. The good thing about this, the good thing about this website is you have your own account. So if I go on today and form an account and choose 50 housing authorities, and I can go on next week and add 10 or subtract 2 and I change it. I can also update my mailing address, update my family composition. So there's a lot of, that's the way to do it. So when we're telling someone or advising someone or guiding someone on how to conduct a housing search, you complete the Section 8 applications. Even though they're not easy to get, we have folks do that. And then you move over to the CHAMP application and complete your CHAMP application online. There are also private companies. I think someone mentioned Maloney Properties. There are also private companies that own or manage project-based voucher unit properties. In Boston here, Maloney Properties, State Street, Community Builders. These are private companies that are not connected with the government. They're not part of the state or the federal government, but they also run these PBVs, or the project-based voucher units. They might have mixed income living situations where they could, they have a building over there with 10% of the units have these PBV, project-based voucher, connected to them. There's also something called affordable housing. Affordable housing is based on AMI, which is area median income. It's not based on the consumers or clients' income. It's based on the AMI, or the cost of living. Okay. It may not be all that affordable. I mean, it could be $800. Your affordable rent is $800. But for somebody whose income is from supplemental security income, who is getting $800, that's not all that affordable to them.
Andy, if you could finish your thought, and then we have some questions. So just giving you like a minute warning.
Sure. Yeah, I don't have a watch, so I'm working.
Yeah, no, that's okay. Yeah.
Okay. I could go on forever.
Right. So yeah, 1 minute, and then we have.
All
some
right.
questions.
So this point I wanted to make was in those type of buildings where there's Maloney Properties, those type of buildings, there could be there's mixed income. So you're paying a subsidized rent, 30% of your income. There could be some people there that are paying affordable rent, whatever the affordability is, and then other people that are paying market rent. And market rent is quite high here in Massachusetts. So that's mixed income housing. So that so again, you know, and there's lots of tips that we can give people. Megan, I think, mentioned about being organized and keeping lists, and so you're able to follow up and you update your address and things like that. But yeah, I'm willing to take questions, of course.
All right, Andy, thank you so much. Wow, that was a ton of really practical information.
And I do want to mention one quick thing. We do, you know, I mentioned in the beginning, we have a housing workshop, and it's by Zoom and in person. So if folks are interested in that, it's the first and third Wednesday. We have our next one, July 6th, where this was a condensed version, but where I can go on for like about an hour and a half.
No, that's great. And I suppose we could go on to the website and find out how to apply, how to register for those workshops.
Yeah, actually there's a pre-recorded housing workshop on our website. The PowerPoint is on the website www.bostoncil.org.
Okay.
So lots of good information.
Great. Great. Thanks so much. We did have a question, which I think Cathy may have answered, that does every housing authority accept CHAMP? And Cathy said they are all required. So if you put all of your applications in the CHAMP system, then everyone has to accept those?
If it's for state-funded, site-based, or for EHBP.
The only exception is the Boston Housing Authority. The Boston Housing Authority likes to be on their own, so they have their own portal. And so if your intention is to apply for public housing from the Boston Housing Authority, you have to go directly to BHA.
Okay, great.
If you go into Boston via the CHAMP, it will take you to the Boston Housing Authority portal link. So you can start it on CHAMP, but then it diverts you to their portal.
Yeah.
Got it. Okay. Thanks. What other questions do we have? Oh, Rachel, yeah, you had raised your hand.
Yep.
Where are you? Oh, there you go.
Yeah, thank you, Andy, for all that information. It's great. So I know that BCIL does a lot of advocacy around getting more vouchers. Would you mind telling us, like, what's the status of the funding of the vouchers for this year? And also, I know you do work around getting people who are in nursing homes because there's not accessible housing out there. So would you mind talking a little bit about that as well? What options are available with helping people who really, their nursing home is not the type of support that they need, but they're just there because there's no accessible housing?
Sure. At the end of the day, the Boston Center for Independent Living and Independent Living Center is a community organizing disability advocacy agency. The independent living movement was started by people with disabilities, actually in Boston University. BCIL was founded in 1973 when people from Boston University wanted to get their brothers and sisters out of nursing homes. So it's all about independent living. We have a personal care attendant department. But that's basic. So we do a lot of advocacy and talking to state legislators, talking to the governor about, we don't have much influence over the mobile voucher, the federal housing choice voucher program voucher, but the state vouchers, the alternative housing voucher program and the mass rental voucher program we do. We've gotten, over the last, I think it's 5 years, we've gotten $8 million more into the alternative housing voucher program, which I think the numbers are, I could be wrong, 120 different vouchers, that 120 additional vouchers are available. There is, in terms of advocacy, do you increase the value of the voucher or do you increase the numbers of the voucher? Because I almost think there's almost collusion going on among landlords that are saying that we'll just raise the rent to above the income ceiling of these vouchers. And that way, it just makes it harder. So there's always this kind of internal debate about what should we do? Should we increase the value or increase the numbers? But we have increased the numbers, and we always mention that if people want to join our effort, anyone wants to join our effort, and whether it's to visit the State House in person, and they are open now, or to make calls or write letters or whatever, join our advocacy, our community organizing team, we can make that happen. That's a good thing. So we keep we keep increasing, and we have Shia French is the head of that effort. She's in our community organizing department, and she would love to talk to people about joining our effort. And our director, Bill Henning, will say all the time, we need housing, 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 more housing, and then more housing after that.
Andy, do you think you could email us, the organizers, some information about, or like where, what we might do to support that effort, and then we can share it with the group?
Sure, yeah.
That'd be great.
Yeah, or you can just contact the Boston Center for Independent Living. We have a website. There's a big red button to contact us, but sure, I'll
okay. All right, great. No, that's helpful too. Yeah. No, thank you so much. So yeah, that was excellent. And yeah, thank you to all three of you, Cathy, Megan, and Andy, for those talks that like we hoped they were perfectly, sort of unique in what you shared with us. So I'd just like to open up the discussion and let people who haven't spoken or asked anything, to speak up, and just think if you have other questions specifically for the speakers, that's fine too. But I also was just wondering, if there's any other barriers to housing that have not been mentioned today. I mean, I know we mentioned a lot. I know that the barriers are sort of the easy part to know, but if there's anything that wasn't addressed today that people Beth, go ahead.
Sure. Two things, Julie. First, I see in the chat that Jenny had a question. Maybe you can take that after me. As I listened to all of this, and I've heard a lot of it before, it just strikes me about how decentralized and overwhelming this is for anybody, right? And it feels like, because it takes so long and there's so many systems to understand, that someone would need, I would need, for instance, if I were doing it, some hand-holding. Like, who's going to help me with this? Who's going to help me keep it straight? I hear Cathy say she's got a spreadsheet, which is fabulous, but I would want a person that I could walk through it with. And so who plays that role? I guess this is to all of the speakers. Where do people, it's an overwhelming system, very frankly. Who are the people that someone could go to, a person with a disability who needs housing, and say, I need help with the whole system. I don't understand it. I don't know what to do. It's going to take a long time. Who can provide that?
The Boston Center for Independent Living can assist. For anyone that starts into the request, I mean, our process is you call our office, you talk to the information referral department, then you are referred to our housing workshop. And one of the last things I'll tell people is that you can sign up for one-on-one services with a disability peer advocate. Just because of numbers, even, for example, the folks that came yesterday, I said, you can sign up for one-on-one counseling or one-on-one support, but you may not be seen for another month just because of numbers, and we're not that big of an agency. So, but we do that. I mean, at the end of the day, that's what we do. We provide support, and different people need different levels of support. You know, whether that support is completing the housing application, we do try to encourage folks to complete as much as they can and come to us with, well, I have trouble with question number 17 or something like that. But sometimes you do need to sit down, depending on their disability, depending on where they are, and complete it with them, whether they're on the phone or on Zoom or anything else like that. But whatever level of support that they need, our disability peer advocates can provide.
That's great. I imagine that a bunch of other people on this call also provide support from your organizations. And so if you could, if your organization does provide that, what Beth was asking about, if you could put in your website and if there's any, you know, sort of parameters to the type of support you provide around housing, that would be great. And then we can collect all those and distribute those, because I'm sure a lot of you do similar support work.
Thank you.
Thanks, Andy, and thanks, Beth, for the question. And sorry, Ginny, I missed this question, but Beth reminded me. So Ginny asks, do affordable building lotteries have or consider priorities such as disabled, elder, homelessness? Yeah, so how does that work?
It depends, is the short answer.
Okay, on what?
It depends. So obviously certain buildings are just for elderly and people with disabilities. I've also seen it where, you know, we're taking applications right now, and then you contact them and say, all of our disability slots are full. We're only taking applications from the elderly right now. So it depends. Lotteries in general, there's like a percentage will be local preference. But a big issue that I just wanted to pivot onto is you got a voucher, now what?
Mm-hmm.
So there's a couple of problems there. One, which Andy very eloquently summed up, is that, you know, landlords can just raise the price above what the voucher will cover. And the savvy landlords all know that. And they do it. They can't just do it for you. They have to be doing it for everybody. But it's a big problem. If the fair market rent for a one-bedroom voucher in Boston is $1,950 a month, but 2/3 of one-bedrooms in Boston rent for $2,100 a month or more, what do you do? And so there's a couple of answers to that question. One is that some housing authorities have adopted what are called HUD small area fair market rents. So for example, in Brookline, a one bedroom, depending on the zip code, the voucher may cover up to $2,700 a month. But housing authorities aren't required to use the HUD small area FMRs. They can choose whether or not to use them. So that's one. Another is there's wiggle room. So in theory, it caps at $1,950 a month, but you can go up to 110% of the FMR. And as a reasonable accommodation for disability, you can go up to 120% of the FMR. And then the other way the landlords stop people from getting in is using credit scores. So it's illegal to not rent to somebody because they have a voucher, but it's not illegal to rent to somebody because they have a poor credit score or no credit score. And so one thing I tell people, and you're not allowed to use a cosigner with a voucher. So one of the things I tell people is look into getting your family member a secured credit card so they can build a credit score. Also, the tax credit buildings, you know, Maloney, Wynn, Avalon, etc., are required to look at doing alternative financial qualifying. So just because you don't have a credit score, they can't turn you down. They have to go into alternative methods. They do things like, we want the last 12 months of bank statements. We want a copy of your Social Security benefit letter, yada, yada, yada. And, you know, in addition to the resources that have already been mentioned, the Housing Navigator and Housing Works, I also want to put in a plug for Metro List, is another way to find places. So.
Thank you. Thank you. I have a quick question that I heard perhaps maybe from a talk you gave before, Cathy, but so for people who are in group homes that are, you know, paid for by a portion of their Social Security, if they apply for Section 8 and get Section 8, is it true that they can then get that to pay for a portion of their group home so that they have more of their SSI money for themselves?
It will not give them any more money, but it will improve the budget of the group home. So in
Okay.
other words, if you're in a group home or shared living, under statute, you have to pay 75% of your net income to the provider. So my son lives in a group home and he's got a Section 8 voucher.
Yeah.
So his group home is his landlord. And what that means is that his group home gets an extra check for $320 a month from the Woburn Housing Authority, which is really important for things like when you open a group home, DDS gives you an initial budget for furniture. DDS does not continue to pay for furniture after that. And in my son's house, couches are not a durable good. All right. They cycle through those things like nobody's business. And, you know, and everybody, you know, so the Section 8 voucher buys a new couch and it pays the cable bill.
Yeah, no, that's great to know. Yeah, it's funny. My son's group home, I walked in the other day and the couch was gone. So I hear what you're saying. Okay, thanks. So, yeah, so we have a few more minutes. So if anyone wants to comment on, you know, I don't know what I'm curious if anyone from the group, you know, will sort of do things differently or found new insights from this talk that might, you know, change a little bit what you do within your organization or what you promote or what you share with your clients. Any comments? No? Okay.
I would agree with, I forget who just said it, but that the housing search process is overly complicated, can be overwhelming. I hear it almost every day. People get frustrated, people cancel appointments, things like that, because the process is just overwhelming, and it maybe it shouldn't be this hard, but it is what it is, I guess.
Yeah. So given that, you know, Beth asked this before, and Andy, you answered with the, you know, the information and the workshops you have from the Independent Living Center. But does anyone know of any other sort of beginning resources for people who are about to start this process? Like, you know, yeah, we can go to the workshop at Andy's place, and there's other things, but what about any just sort of online resources that sort of lay out the basic options and the basic things you have to know? Does anyone have suggestions on that?
You know, I just put it in the chat. Mass Housing does have a lot of nice resources. They have a tenant assistance program to prevent eviction and other programs. They have help with sometimes hoarding or other things. And so I find Mass Housing, we are really blessed in Massachusetts. Most states have like one housing agency. And the good news for us is we've got like 6, right? Like we have, you know, amazing housing authorities, you know, all over, the large ones, and then, you know, the smaller towns. Cathy's from, you know, Winchester. Like we have a lot of those programs. We have Mass Housing. We've got financing programs like CDAC. And so getting to know the alphabet soup, I do think is important. And then making friends within those organizations. I do think I put in the chat that resource to consider.
Thank you, Megan. No, that's really helpful. Julia, you have a question or a comment?
Yeah, I know we're almost at time, and I was trying to figure out how to put this in the chat, but I just wondered, and I'm sorry if I missed this, the presentations were all great. Thank you so much to all 3 of the speakers. It's just a phenomenal amount of useful information. And you may have addressed this and I missed it, but can you talk a little bit in the minute we have about if you haven't, how to address language access barriers for families and individuals with disabilities whose primary languages in English? How well the system does or doesn't address that?
Could you repeat the last part of that?
how well the system does or does not address language access barriers for individuals with disabilities and families whose primary language is not English.
The closest thing that I know of to that is Metro Housing Boston provides copies of applications in 6 key languages. And, you know, they've got the Google Translate icon on their website, but, you know, that's machine translation. So we know what that's like. That's a really good question. I've got a question I'm trying to deal with right now where, you know, somebody wants me to do applications with a family where their first language is Thai. So, you know, and I'm trying to figure out how to do that.
Well, in terms of, you know, you can use the language line and try to get an interpreter that way, but also the pupils whose primary language is American Sign Language, that's another barrier towards this entire housing process, and it makes it not easy. I mean, we have consumers whose primary language is ASL. I mean, we also work a lot with helping people maintain benefits. I do a lot of work with Social Security. I have a couple consumers whose ASL, and you know, you would think the federal government, the Social Security Administration would accommodate, but I had to fight tooth and nail, and they finally did. But DTA on the state level, Department of Transitional Assistance, I still had to fight, but they were a lot easier fight to win in terms of accommodating. So communication access is an issue, whether it's Thai or American Sign Language.
No, that's true. So thank you. I want to ask quickly if people would mind if we took just a screenshot of this meeting, just sort of to have as a promotion for future meetings. So if you're willing to do that, keep your camera on or put your camera on, and you know, maybe wave, and we'll take a screenshot. And if the other steering committee members can all take screenshots, so we know that one will come out. So thanks so much.
Thank you.
All right. Okay. Thank you everyone for being here. This was great, and thank you to our speakers, Cathy and Megan and Andy. That was excellent and just what we hoped. If anyone has any questions, you know, feel free to email back the steering committee members. I think the emails usually come from Joanne. But anyway, thank you so much. We appreciate you all being here.
Thank you.
Thanks, everyone.
All right.
Thanks, everyone.
Bye-bye.
Bye-bye.
Thank you.